Hi, everyone. This is Nurse Anna from nursestudy.net, and here are 25 questions with answers and rationales regarding cardiac arrhythmias. I hope you enjoy this one. Let me know in the comments below. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 65-year-old male patient with a history of atrial fibrillation presents to the emergency department complaining of dizziness and palpitations. His heart rate is irregular, and an ECG shows atrial fibrillation with a ventricular rate of 130. Which of the following interventions should the nurse anticipate the healthcare provider will order to stabilize the patient? A. Vagal maneuvers. B. Beta blockers. C. Adenosine. D. Anticoagulants. Answer: B. Beta blockers. Rationale: in cases of atrial fibrillation with rapid ventricular response, beta blockers, such as metoprolol, are commonly used to control the heart rate. Vagal maneuvers are not effective in atrial fibrillation. Adenosine is used for paroxysmal supraventricular tachycardia, not atrial fibrillation. Anticoagulants are used to prevent thromboembolism but do not directly manage the acute rate control. Question 2. A 58-year-old female patient is admitted to the cardiac unit after experiencing a sudden onset of palpitations and shortness of breath. The ECG reveals a ventricular rate of 180 with wide QRS complexes. The nurse suspects ventricular tachycardia. What should the nurse anticipate as the priority intervention? A. Synchronized cardioversion. B. Defibrillation. C. Epinephrine administration. D. Amiodarone infusion. Answer: A. Synchronized cardioversion. Rationale: synchronized cardioversion is indicated for patients with ventricular tachycardia who are hemodynamically unstable but still have a pulse. Defibrillation is used for pulseless ventricular tachycardia or ventricular fibrillation. Epinephrine is not the first-line treatment for ventricular tachycardia with a pulse, and amiodarone may be used after cardioversion or if the patient is stable. Question 3. A patient with a known history of atrial fibrillation presents to the clinic for follow-up. The patient is not currently on any anticoagulation therapy and has been experiencing intermittent episodes of chest pain and dyspnea. The nurse recognizes the patient is at risk for which of the following complications? A. Myocardial infarction. B. Deep vein thrombosis. C. Pulmonary embolism. D. Stroke. Answer: D. Stroke. Rationale: atrial fibrillation increases the risk of thrombus formation in the atria, which can embolize to the brain, causing a stroke. While deep vein thrombosis and pulmonary embolism are also thromboembolic events, they are less directly related to atrial fibrillation. Myocardial infarction can occur, but stroke is the most common complication associated with untreated atrial fibrillation. Question 4. A patient in the intensive care unit suddenly develops an irregular heart rate and the monitor shows a polymorphic ventricular arrhythmia consistent with torsades de pointes. The nurse should prepare to administer which of the following medications? A. Magnesium sulfate. B. Atropine. C. Lidocaine. D. Dopamine. Answer: A. Magnesium sulfate. Rationale: torsades de pointes is a specific type of ventricular tachycardia often associated with prolonged QT intervals. Magnesium sulfate is the drug of choice for this arrhythmia. Atropine is used for bradycardia, lidocaine is used for ventricular arrhythmias, but not torsades specifically, and dopamine is used for hypotension, not arrhythmia management. Question 5. A 72-year-old patient with a history of congestive heart failure is on digoxin therapy and presents with complaints of nausea, dizziness, and visual disturbances. The nurse notes a heart rate of 50. Which of the following arrhythmias is the patient most likely experiencing? A. Atrial flutter. B. Sinus bradycardia. C. Junctional rhythm. D. Atrial fibrillation. Answer: B. Sinus bradycardia. Rationale: the symptoms of nausea, dizziness, and visual disturbances are classic signs of digoxin toxicity, which can lead to sinus bradycardia. Atrial flutter and fibrillation would present with irregular rhythms, and junctional rhythms typically have a rate between 40 and 60 beats per minute, but are not typically caused by digoxin toxicity. Question 6. A nurse is caring for a 45-year-old patient who has developed a third-degree heart block. The patient is hemodynamically unstable, with a heart rate of 30. Which intervention should the nurse anticipate? A. Intravenous calcium gluconate. B. Temporary transcutaneous pacing. C. Adenosine. D. Electrical defibrillation. Answer: B. Temporary transcutaneous pacing. Rationale: third-degree heart block, also known as complete heart block, requires immediate intervention, typically with temporary transcutaneous pacing if the patient is hemodynamically unstable. Adenosine is used for supraventricular tachycardias, not heart block. Calcium gluconate is used in cases of hyperkalemia, not heart block. Defibrillation is used for ventricular fibrillation or pulseless ventricular tachycardia, not heart block. Question 7. A patient presents to the emergency room with chest pain, nausea, and shortness of breath. The ECG reveals ST segment elevation in leads V1 to V4. Shortly after, the patient develops ventricular fibrillation. What is the priority action the nurse should take? A. Administer IV amiodarone. B. Administer supplemental oxygen. C. Initiate CPR and defibrillation. D. Administer IV epinephrine. Answer: C. Initiate CPR and defibrillation. Rationale: ventricular fibrillation is a life-threatening arrhythmia that requires immediate defibrillation and CPR as the priority intervention. Amiodarone and epinephrine may be administered if the defibrillation fails to restore a normal rhythm, but CPR and defibrillation are the priority. Question 8. A 55-year-old male with a history of ischemic cardiomyopathy presents with palpitations and an ECG showing monomorphic ventricular tachycardia at a rate of 160. The patient is alert but complains of dizziness and lightheadedness. What is the most appropriate action by the nurse? A. Administer IV lidocaine. B. Prepare for synchronized cardioversion. C. Administer IV adenosine. D. Administer IV digoxin. Answer: B. Prepare for synchronized cardioversion. Rationale: in the case of a hemodynamically unstable ventricular tachycardia with a pulse, synchronized cardioversion is the recommended intervention. Lidocaine may be used if the patient remains stable. Adenosine is ineffective for ventricular tachycardia, and digoxin is not used in acute management of ventricular tachycardia. Question 9. A patient with chronic atrial fibrillation is being discharged with a prescription for warfarin. The nurse is providing discharge teaching. Which statement by the patient indicates the need for further teaching? A. I will have my INR checked regularly to adjust my dose. B. I need to eat more green leafy vegetables to improve my health. C. I will report any signs of bleeding, such as bruising or black stools. D. I should avoid contact sports to reduce my risk of injury. Answer: B. I need to eat more green leafy vegetables to improve my health. Rationale: warfarin interacts with vitamin K, which is found in green leafy vegetables. Increasing intake of these vegetables can interfere with the effectiveness of warfarin, leading to an increased risk of clot formation. The other statements are correct and indicate appropriate understanding of warfarin management. Question 10. A 48-year-old patient is admitted with a diagnosis of hypertrophic cardiomyopathy and is experiencing episodes of ventricular tachycardia. The nurse anticipates the healthcare provider will order which of the following medications to reduce the risk of sudden cardiac death. A. Atropine. B. Beta blockers. C. Norepinephrine. D. Calcium channel blockers. Answer: B. Beta blockers. Rationale: Beta blockers, such as metoprolol, are commonly used in hypertrophic cardiomyopathy to reduce the risk of arrhythmias and sudden cardiac death by decreasing the heart rate and improving diastolic filling. Atropine is used for bradycardia, norepinephrine for hypotension, and calcium channel blockers may help in some cases but are not typically first line for arrhythmia control. Question 11. A patient with a history of myocardial infarction suddenly collapses. The ECG monitor shows ventricular fibrillation. The nurse knows the priority action is to A. Administer epinephrine. B. Perform a precordial thump. C. Begin chest compressions and defibrillation. D. Administer amiodarone. Answer: C. Begin chest compressions and defibrillation. Rationale: ventricular fibrillation is a life-threatening arrhythmia that requires immediate defibrillation and chest compressions. Epinephrine and amiodarone are used after defibrillation if necessary. The precordial thump is no longer recommended for routine use and is considered an outdated practice. Question 12. A patient with a heart rate of 38 is experiencing dizziness and hypotension. The ECG reveals third-degree heart block. What is the most appropriate action by the nurse? A. Prepare the patient for temporary transcutaneous pacing. B. Administer atropine. C. Administer a beta blocker. D. Perform a vagal maneuver. Answer: A. Prepare the patient for temporary transcutaneous pacing. Rationale: third-degree heart block requires immediate intervention with transcutaneous pacing, especially if the patient is symptomatic with hypotension and bradycardia. Atropine may be ineffective in third-degree heart block. Beta blockers would further slow the heart rate, and vagal maneuvers are contraindicated in this situation. Question 13. A 62-year-old patient is diagnosed with atrial flutter and is scheduled for an elective cardioversion. What is the nurse's priority action before the procedure? A. Ensure the patient has been NPO for 8 hours. B. Administer anticoagulant therapy as prescribed. C. Perform a 12-lead ECG. D. Administer IV sedation. Answer: B. Administer anticoagulant therapy as prescribed. Rationale: in atrial flutter, anticoagulation is essential before elective cardioversion to prevent thromboembolic events. Ensuring the patient is NPO and administering IV sedation are also important but are secondary to anticoagulation. A 12-lead ECG may be performed before the procedure but is not the priority. Question 14. A 70-year-old patient presents with bradycardia, hypotension, and syncope. The ECG shows sinus bradycardia with a rate of 30. What is the first-line treatment the nurse should anticipate? A. Adenosine. B. Atropine. C. Magnesium sulfate. D. Defibrillation. Answer: B. Atropine. Rationale: atropine is the first-line treatment for symptomatic bradycardia. It works by increasing the heart rate. Adenosine is used for supraventricular tachycardia, magnesium sulfate is used for torsades de pointes, and defibrillation is used for life-threatening arrhythmias like ventricular fibrillation. Question 15. A patient with long QT syndrome is admitted to the emergency department after a syncopal episode. The nurse monitors the patient for the development of which of the following life-threatening arrhythmias? A. Ventricular fibrillation. B. Supraventricular tachycardia. C. Atrial flutter. D. Torsades de pointes. Answer: D. Torsades de pointes. Rationale: long QT syndrome increases the risk of developing torsades de pointes, a polymorphic ventricular tachycardia that can lead to sudden cardiac death. Ventricular fibrillation is also life-threatening but is not directly associated with long QT syndrome. Supraventricular tachycardia and atrial flutter are not typically complications of long QT syndrome. Question 16. A 58-year-old patient with dilated cardiomyopathy is being monitored in the ICU. The nurse notes an episode of ventricular tachycardia on the monitor, but the patient remains stable. What is the next action the nurse should anticipate? A. Administer a beta blocker. B. Perform synchronized cardioversion. C. Administer IV amiodarone. D. Prepare for defibrillation. Answer: C. Administer IV amiodarone. Rationale: for stable ventricular tachycardia, the first-line treatment is often an antiarrhythmic medication, such as amiodarone. Synchronized cardioversion would be used if the patient becomes unstable. Defibrillation is used for pulseless ventricular tachycardia or ventricular fibrillation. Beta blockers are not typically used in acute management of ventricular tachycardia. Question 17. A patient with atrial fibrillation has been prescribed dabigatran. During discharge teaching, the nurse explains that the patient should avoid which of the following? A. Grapefruit juice. B. Green leafy vegetables. C. Nonsteroidal anti-inflammatory drugs, NSAIDs. D. Dairy products. Answer: C. Nonsteroidal anti-inflammatory drugs, NSAIDs. Rationale: NSAIDs increase the risk of bleeding, which can be dangerous for patients on anticoagulants like dabigatran. Grapefruit juice and dairy products do not have significant interactions with dabigatran, and green leafy vegetables primarily affect warfarin, not dabigatran. Question 18. A patient with a history of coronary artery disease and a recent myocardial infarction presents with chest pain and shortness of breath. The ECG reveals frequent premature ventricular contractions, PVCs. The nurse should anticipate which of the following interventions? A. Administer IV adenosine. B. Administer IV amiodarone. C. Administer sublingual nitroglycerin. D. Perform synchronized cardioversion. Answer: B. Administer IV amiodarone. Rationale: amiodarone is commonly used to treat frequent PVCs, especially in patients with a history of myocardial infarction, as it helps stabilize the ventricular rhythm. Adenosine is used for supraventricular tachycardias, and nitroglycerin is used for chest pain associated with ischemia. Cardioversion is not indicated for PVCs. Question 19. A 45-year-old patient presents with syncope, and the ECG reveals an abnormal, prolonged QT interval. The nurse recognizes that the patient is at risk for which arrhythmia? A. Ventricular fibrillation. B. Atrial fibrillation. C. Atrioventricular block. D. Torsades de pointes. Answer: D. Torsades de pointes. Rationale: a prolonged QT interval increases the risk of torsades de pointes, a type of polymorphic ventricular tachycardia. Atrial fibrillation and atrioventricular block are not directly related to QT prolongation, and while ventricular fibrillation is a life-threatening arrhythmia, it is not the primary concern with prolonged QT. Question 20. A patient is experiencing paroxysmal supraventricular tachycardia with a heart rate of 180. The nurse prepares to administer which medication to convert the rhythm? A. Amiodarone. B. Adenosine. C. Atropine. D. Digoxin. Answer: B. Adenosine. Rationale: adenosine is the first-line drug for treating paroxysmal supraventricular tachycardia as it works quickly to interrupt the re-entry pathways causing the tachycardia. Amiodarone is used for ventricular arrhythmias, atropine for bradycardia, and digoxin is not first-line for acute PSVT management. Question 21. A patient presents to the emergency department with chest pain and shortness of breath. The ECG shows atrial fibrillation with a rapid ventricular rate of 140. Which intervention should the nurse anticipate to control the patient's heart rate? A. Administer IV calcium gluconate. B. Administer IV beta blockers. C. Administer IV adenosine. D. Perform defibrillation. Answer: B. Administer IV beta blockers. Rationale: IV beta blockers, such as metoprolol, are commonly used to control the heart rate in atrial fibrillation with a rapid ventricular response. Adenosine is used for PSVT, calcium gluconate is used in hyperkalemia, and defibrillation is not indicated unless the patient is hemodynamically unstable. Question 22. A patient is experiencing symptomatic bradycardia with a heart rate of 35. The nurse prepares to administer which medication as the first-line treatment? A. Epinephrine. B. Atropine. C. Amiodarone. D. Dopamine. Answer: B. Atropine. Rationale: atropine is the first-line medication for treating symptomatic bradycardia as it increases the heart rate by blocking the effects of the vagus nerve. Epinephrine and dopamine are used if atropine is ineffective. Amiodarone is used for ventricular arrhythmias, not bradycardia. Question 23. A patient with a known history of long QT syndrome is admitted after experiencing a syncopal episode. The nurse understands that which of the following electrolyte imbalances should be corrected to prevent arrhythmias? A. Hypernatremia. B. Hypermagnesemia. C. Hypocalcemia. D. Hypokalemia. Answer: D. Hypokalemia. Rationale: hypokalemia is associated with a higher risk of developing life-threatening arrhythmias such as torsades de pointes, particularly in patients with long QT syndrome. Correcting electrolyte imbalances, especially potassium and magnesium, is essential to prevent arrhythmias. Hypernatremia and hypermagnesemia are less commonly associated with arrhythmias, and hypocalcemia is not typically a concern in this context. Question 24. A patient with a history of heart failure presents with new onset atrial fibrillation. The nurse understands that the patient is at increased risk for which of the following complications? A. Myocardial infarction. B. Deep vein thrombosis. C. Pulmonary embolism. D. Thromboembolic stroke. Answer: D. Thromboembolic stroke. Rationale: atrial fibrillation increases the risk of thrombus formation in the atria, which can embolize and cause a stroke. Deep vein thrombosis and pulmonary embolism are also thromboembolic events, but are not directly caused by atrial fibrillation. Myocardial infarction is possible in heart failure, but is not the primary complication of atrial fibrillation. Question 25. A patient presents to the emergency department with palpitations and lightheadedness. The ECG shows a narrow complex tachycardia at a rate of 180. The nurse applies vagal maneuvers, but the patient's rhythm does not convert. What is the next action the nurse should anticipate? A. Administer IV adenosine. B. Perform synchronized cardioversion. C. Administer IV amiodarone. D. Administer IV digoxin. Answer: A. Administer IV adenosine. Rationale: adenosine is the next step in managing paroxysmal supraventricular tachycardia, PSVT, if vagal maneuvers fail. Synchronized cardioversion is used if the patient becomes unstable or if adenosine is ineffective. Amiodarone is used for ventricular arrhythmias, and digoxin is not the first-line treatment for acute PSVT.
Hi everyone, this is Nurse Anna from nursestudy.net, and here are 25 questions with answers and rationales for congenital heart defects. Enjoy.
Question 1. A 6-month-old infant is admitted with cyanosis and diagnosed with tetralogy of Fallot. The nurse notes that the child often squats after becoming short of breath during feeding. What is the primary reason for the infant's squatting behavior? A. The infant is attempting to relieve abdominal pressure. B. Squatting increases blood return to the heart. C. Squatting decreases the heart rate to improve oxygenation. D. The infant squats to relieve pain. Answer: B. Squatting increases blood return to the heart. Rationale: squatting in infants with tetralogy of Fallot increases systemic vascular resistance, which helps reduce right-to-left shunting of blood through the heart and improves oxygenation. This behavior is an adaptive response to hypoxemia. Question 2. A nurse is caring for a 3-year-old child diagnosed with a ventricular septal defect, VSD. During assessment, the nurse notes a harsh holosystolic murmur at the lower left sternal border. What is the most likely explanation for this finding? A. Increased pulmonary blood flow. B. Right ventricular hypertrophy. C. Decreased oxygen saturation. D. Left atrial enlargement. Answer: A. Increased pulmonary blood flow. Rationale: a ventricular septal defect allows blood to flow from the left ventricle to the right ventricle, leading to increased pulmonary blood flow. The harsh holosystolic murmur is caused by the turbulence of blood flow through the defect. Question 3. An infant is diagnosed with coarctation of the aorta. The nurse expects which of the following findings during the assessment? A. Bounding femoral pulses. B. Lower blood pressure in the upper extremities. C. Diminished pulses in the lower extremities. D. Equal pulses in both upper and lower extremities. Answer: C. Diminished pulses in the lower extremities. Rationale: coarctation of the aorta is characterized by a narrowing of the aorta, typically after the origin of the subclavian arteries. This results in decreased blood flow to the lower extremities, leading to diminished pulses and lower blood pressure in the legs compared to the arms. Question 4. A newborn is diagnosed with transposition of the great arteries, TGA. What intervention does the nurse anticipate as the priority before surgical correction? A. Administration of diuretics. B. Prostaglandin infusion. C. Immediate intubation. D. Antibiotic prophylaxis. Answer: B. Prostaglandin infusion. Rationale: in newborns with transposition of the great arteries, maintaining the patency of the ductus arteriosus is critical to allow for mixing of oxygenated and deoxygenated blood. Prostaglandin E1 is administered to keep the ductus arteriosus open until surgical correction can be performed. Question 5. A nurse is caring for a 2-year-old with a history of patent ductus arteriosus, PDA, who is scheduled for surgical closure. The nurse understands that the main goal of the surgery is to A. Decrease cyanotic episodes. B. Prevent left to right shunting of blood. C. Improve right ventricular function. D. Reduce the risk of arrhythmias. Answer: B. Prevent left to right shunting of blood. Rationale: patent ductus arteriosus, PDA, causes abnormal communication between the aorta and pulmonary artery, leading to left to right shunting of blood. Surgical closure prevents this shunting and reduces the risk of pulmonary hypertension and heart failure. Question 6. A nurse is assessing a 5-year-old child with a history of atrial septal defect, ASD. The child is at risk for developing which long-term complication? A. Pulmonary embolism. B. Stroke. C. Ventricular hypertrophy. D. Pulmonary hypertension. Answer: D. Pulmonary hypertension. Rationale: atrial septal defect, ASD, leads to increased blood flow to the lungs, which over time can result in pulmonary hypertension. This complication arises from increased pressure in the pulmonary arteries due to the left to right shunt. Question 7. An infant with hypoplastic left heart syndrome is being evaluated for surgical intervention. What is the priority nursing assessment before the procedure? A. Monitoring for signs of sepsis. B. Assessment of liver function. C. Evaluating oxygen saturation levels. D. Monitoring for signs of congestive heart failure. Answer: C. Evaluating oxygen saturation levels. Rationale: in infants with hypoplastic left heart syndrome, the left side of the heart is underdeveloped, leading to decreased systemic perfusion. Evaluating oxygen saturation is critical as these patients often have low oxygen levels, and maintaining adequate oxygenation is a priority before surgical intervention. Question 8. A 3-month-old with truncus arteriosus is scheduled for surgical repair. What condition is this infant at highest risk for developing if left untreated? A. Severe mitral regurgitation. B. Pulmonary hypertension. C. Systemic hypertension. D. Aortic stenosis. Answer: B. Pulmonary hypertension. Rationale: truncus arteriosus involves a single arterial trunk arising from the heart, supplying both the systemic and pulmonary circulations. This results in increased blood flow to the lungs, leading to the development of pulmonary hypertension if not corrected surgically. Question 9. A nurse is educating the parents of a child with tetralogy of Fallot about potential complications. Which of the following should the nurse emphasize as a sign of an emergency? A. Frequent crying. B. Increased activity level. C. Sudden episodes of deep cyanosis. D. Decreased appetite. Answer: C. Sudden episodes of deep cyanosis. Rationale: blue spells or tet spells are episodes of severe cyanosis due to decreased oxygen in children with tetralogy of Fallot. These episodes require immediate intervention to prevent hypoxic brain injury and other complications. Question 10. A 4-year-old with an unrepaired atrioventricular septal defect, AVSD, presents with frequent respiratory infections and poor growth. The nurse anticipates which of the following management strategies? A. Diuretic therapy and increased calorie intake. B. Long-term antibiotic therapy. C. Antihypertensive medication. D. Immediate intubation and mechanical ventilation. Answer: A. Diuretic therapy and increased calorie intake. Rationale: children with unrepaired AVSD often have congestive heart failure symptoms due to the large left-to-right shunt, leading to poor growth and frequent respiratory infections. Diuretics reduce fluid overload, and increased calorie intake supports growth. Question 11. A nurse is caring for an infant with tricuspid atresia who is awaiting surgical correction. The nurse anticipates that the child will require which of the following medications to help maintain oxygenation until surgery? A. Indomethacin. B. Prostaglandin E1. C. Beta blockers. D. Digoxin. Answer: B. Prostaglandin E1. Rationale: in tricuspid atresia, the absence of a tricuspid valve leads to poor mixing of oxygenated and deoxygenated blood. Prostaglandin E1 is administered to keep the ductus arteriosus open, allowing for adequate blood flow to the lungs until surgery can be performed. Question 12. A nurse is caring for a newborn with total anomalous pulmonary venous return. Which findings should the nurse prioritize when monitoring this patient? A. Tachypnea and cyanosis. B. Bradycardia and low blood pressure. C. Hypertension and bradycardia. D. Hyperglycemia and diaphoresis. Answer: A. Tachypnea and cyanosis. Rationale: total anomalous pulmonary venous return is a defect where the pulmonary veins do not connect normally to the left atrium. This results in poor oxygenation, and signs such as tachypnea and cyanosis indicate inadequate pulmonary circulation, requiring immediate attention. Question 13. A nurse is assessing a 4-year-old child diagnosed with an unrepaired atrial septal defect, ASD. Which assessment finding would indicate a complication associated with this condition? A. Lower extremity edema. B. Decreased lung sounds. C. Jugular venous distension. D. Diminished peripheral pulses. Answer: C. Jugular venous distension. Rationale: an atrial septal defect leads to increased blood flow to the right side of the heart, which can cause right-sided heart failure over time. Jugular venous distension is a sign of increased right atrial pressure and right-sided heart failure. Question 14. A nurse is caring for a 2-month-old with a diagnosis of hypoplastic left heart syndrome. Which of the following symptoms should prompt the nurse to contact the healthcare provider immediately? A. Persistent cough. B. Feeding intolerance and irritability. C. Oxygen saturation at 95%. D. Systolic ejection murmur. Answer: B. Feeding intolerance and irritability. Rationale: feeding intolerance and irritability in an infant with hypoplastic left heart syndrome can indicate worsening heart failure or inadequate systemic perfusion. These symptoms warrant immediate evaluation by the healthcare provider. Question 15. A nurse is educating the parents of a child who is scheduled for surgical correction of a large patent ductus arteriosus, PDA. The nurse explains that if left untreated, a large PDA can result in A. Pulmonary hypertension and heart failure. B. Aortic stenosis and cyanosis. C. Mitral valve prolapse and arrhythmias. D. Right to left shunting of blood. Answer: A. Pulmonary hypertension and heart failure. Rationale: a large patent ductus arteriosus, PDA, leads to significant left-to-right shunting of blood, increasing pulmonary blood flow. Over time, this can cause pulmonary hypertension and heart failure due to increased pressure on the lungs and heart. Question 16. A nurse is assessing a newborn diagnosed with truncus arteriosus. Which clinical manifestation would the nurse expect to find during the initial assessment? A. Cyanosis that worsens with crying. B. Low heart rate. C. Hypertension in the upper extremities. D. Pallor and hypotension. Answer: A. Cyanosis that worsens with crying. Rationale: truncus arteriosus involves a single arterial vessel supplying both systemic and pulmonary circulations. This defect results in mixing of oxygenated and deoxygenated blood, leading to cyanosis that may become more pronounced during crying due to increased oxygen demand. Question 17. A 5-year-old with tetralogy of Fallot is experiencing a hypercyanotic TET spell while playing. What is the nurse's immediate priority action? A. Administer oxygen. B. Place the child in a knee chest position. C. Provide intravenous fluids. D. Notify the healthcare provider. Answer: B. Place the child in a knee chest position. Rationale: the knee chest position increases systemic vascular resistance, which helps reduce the right to left shunting of blood in tetralogy of Fallot, improving oxygenation during a hypercyanotic spell. Question 18. A nurse is caring for an infant diagnosed with pulmonary atresia. Which of the following nursing interventions is a priority for this patient before surgical repair? A. Administering diuretics. B. Monitoring for arrhythmias. C. Maintaining patency of the ductus arteriosus. D. Monitoring for hyperglycemia. Answer: C. Maintaining patency of the ductus arteriosus. Rationale: in pulmonary atresia, the absence of the pulmonary valve means that blood cannot flow from the right ventricle to the lungs. Maintaining the ductus arteriosus with prostaglandin E1 is essential to ensure blood flow to the lungs until surgical repair can be done. Question 19. A 6-week-old infant is diagnosed with a large ventricular septal defect, VSD, and is exhibiting signs of heart failure. What should the nurse anticipate in terms of medical management? A. Administration of diuretics and digoxin. B. Prophylactic antibiotic therapy. C. Administration of antiarrhythmic medications. D. Immediate mechanical ventilation. Answer: A. Administration of diuretics and digoxin. Rationale: in infants with large ventricular septal defects, VSD, heart failure can occur due to increased pulmonary blood flow. Diuretics help reduce fluid overload, and digoxin improves cardiac contractility and reduces symptoms of heart failure. Question 20. A newborn is diagnosed with double outlet right ventricle. Which of the following interventions should the nurse anticipate prior to corrective surgery? A. Administration of prostaglandin to maintain ductal patency. B. Intubation and mechanical ventilation. C. Initiation of antihypertensive therapy. D. Initiation of long-term diuretic therapy. Answer: A. Administration of prostaglandin to maintain ductal patency. Rationale: double outlet right ventricle is a congenital heart defect in which both the aorta and pulmonary artery arise from the right ventricle. Prostaglandin is administered to maintain ductal patency, allowing for better oxygenation until surgery. Question 21. A child with a repaired coarctation of the aorta is being monitored for complications post-surgery. The nurse knows that which of the following is a potential postoperative complication? A. Arrhythmias. B. Rebound hypertension. C. Hypotension in the upper extremities. D. Decreased urinary output. Answer: B. Rebound hypertension. Rationale: after surgical repair of coarctation of the aorta, patients are at risk for rebound hypertension as the body adjusts to the corrected blood flow. This requires close monitoring and potential antihypertensive therapy. Question 22. A nurse is caring for an infant with Ebstein's anomaly. The nurse anticipates which of the following interventions will be required prior to surgical correction. A. Administration of anticoagulants. B. Management of cyanosis with oxygen therapy. C. Use of beta blockers to control arrhythmias. D. Keeping the ductus arteriosus open with prostaglandins. Answer: D. Keeping the ductus arteriosus open with prostaglandins. Rationale: Ebstein's anomaly is a congenital heart defect where the tricuspid valve is malformed, often leading to cyanosis. Keeping the ductus arteriosus open with prostaglandins helps maintain adequate oxygenation until surgery. Question 23. A 3-year-old with an unrepaired ventricular septal defect, VSD, presents with frequent respiratory infections. The nurse understands that the underlying cause of these infections is likely due to A. Immunosuppression caused by VSD. B. Increased pulmonary blood flow. C. Decreased cardiac output. D. Airway obstruction. Answer: B. Increased pulmonary blood flow. Rationale: an unrepaired VSD allows blood to flow from the left ventricle into the right ventricle, increasing pulmonary blood flow. This leads to pulmonary congestion and increases the risk of respiratory infections. Question 24. A nurse is preparing to care for a newborn with a diagnosis of dextrotransposition of the great arteries. The nurse knows that, until surgical correction, the most important intervention is to A. Monitor for signs of systemic embolism. B. Keep the ductus arteriosus open. C. Administer antiarrhythmic medication. D. Initiate fluid restriction. Answer: B. Keep the ductus arteriosus open. Rationale: in dextrotransposition of the great arteries, the aorta and pulmonary artery are transposed, leading to poor oxygenation. Keeping the ductus arteriosus open with prostaglandins allows for oxygenated and deoxygenated blood to mix until corrective surgery. Question 25. A nurse is caring for a newborn with a diagnosis of truncus arteriosus. What complication is the infant at high risk for if surgical intervention is delayed? A. Right ventricular hypertrophy. B. Left atrial enlargement. C. Pulmonary vascular obstructive disease. D. Aortic stenosis. Answer: C. Pulmonary vascular obstructive disease. Rationale: truncus arteriosus results in increased pulmonary blood flow, which can lead to pulmonary vascular obstructive disease, pulmonary hypertension, if not corrected in a timely manner. This condition can permanently damage the pulmonary vasculature.
Hi, everyone. This is Nurse Anna from nursestudy.net. And in this series, we're going to be doing cardiogenic shock questions with answers and rationales. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX, NGN that you can listen to in your car or in the library.
Question 1. A patient with a history of myocardial infarction, MI, presents to the emergency department with hypotension, tachycardia, and cold, clammy skin. Which of the following interventions should the nurse anticipate in the treatment of cardiogenic shock? A. IV fluids bolus to rapidly expand blood volume. B. Administration of dopamine to improve myocardial contractility. C. Initiating high-flow oxygen and positioning the patient in the Trendelenburg position. D. Administering nitroglycerin to reduce myocardial workload. Answer: B. Administration of dopamine to improve myocardial contractility. Rationale: dopamine is commonly used in cardiogenic shock to increase contractility and cardiac output. IV fluids are administered cautiously in cardiogenic shock due to the risk of fluid overload. Oxygen is appropriate, but Trendelenburg positioning is not recommended in cardiogenic shock. Nitroglycerin may decrease myocardial workload but is used with caution due to hypotension. Question 2. A 65-year-old male presents with acute decompensated heart failure. The nurse notes an elevated pulmonary capillary wedge pressure, PCWP, and low cardiac output. What is the primary cause of this patient's cardiogenic shock? A. Increased systemic vascular resistance. B. Impaired left ventricular contractility. C. Fluid overload. D. Ventricular septal defect. Answer: B. Impaired left ventricular contractility. Rationale: cardiogenic shock in this context is typically caused by the failure of the left ventricle to pump blood efficiently, leading to reduced cardiac output and elevated PCWP. Fluid overload can exacerbate the condition but is not the primary cause. Increased systemic vascular resistance and a ventricular septal defect can also contribute but are less common in this presentation. Question 3. A patient is diagnosed with cardiogenic shock following a massive anterior wall MI. The healthcare provider orders norepinephrine. What is the nurse's priority before administering this medication? A. Assessing peripheral pulses. B. Ensuring the patient has an arterial line. C. Obtaining consent for the procedure. D. Checking the patient's oxygen saturation. Answer: B. Ensuring the patient has an arterial line. Rationale: norepinephrine is a potent vasopressor that requires continuous monitoring of blood pressure, often through an arterial line to avoid severe hypertension or hypotension. Peripheral pulses and oxygen saturation are important but not the priority before norepinephrine administration. Question 4. A patient in cardiogenic shock is receiving dobutamine. What is the primary mechanism of action of this drug in managing cardiogenic shock? A. Vasodilation to reduce afterload. B. Increased myocardial contractility and cardiac output. C. Decreased heart rate to reduce myocardial oxygen demand. D. Enhanced renal perfusion to reduce fluid retention. Answer: B. Increased myocardial contractility and cardiac output. Rationale: dobutamine primarily works by increasing myocardial contractility, which boosts cardiac output, making it useful in managing cardiogenic shock. It has minimal effects on heart rate and afterload, and it does not directly enhance renal perfusion. Question 5. A patient is in cardiogenic shock after a severe MI. The nurse notes decreased urine output, confusion, and cool extremities. What does this indicate about the patient's condition? A. The patient is improving. B. The patient is experiencing renal failure. C. The patient is in the early stages of recovery. D. The patient's perfusion is worsening. Answer: D. The patient's perfusion is worsening. Rationale: decreased urine output, confusion, and cool extremities are signs of inadequate perfusion, indicating that the cardiogenic shock is progressing and the organs are not receiving sufficient blood flow. Question 6. A patient in cardiogenic shock has a blood pressure of 70/40 mm of mercury. The healthcare provider orders an intra-aortic balloon pump, IABP. What is the primary goal of this therapy? A. To increase coronary artery perfusion. B. To decrease myocardial oxygen consumption. C. To reduce fluid overload. D. To decrease heart rate. Answer: A. To increase coronary artery perfusion. Rationale: the intra-aortic balloon pump increases coronary artery perfusion by inflating during diastole, helping improve blood flow to the heart. It also decreases afterload, reducing myocardial oxygen consumption, but fluid management is not its primary function. Question 7. The nurse is caring for a patient with cardiogenic shock who is being treated with a continuous infusion of milrinone. Which assessment finding would be of most concern to the nurse? A. Blood pressure of 90/50 mm of mercury. B. A heart rate of 110. C. A potassium level of 4.2 milliequivalent per liter. D. Presence of ventricular dysrhythmias. Answer: D. Presence of ventricular dysrhythmias. Rationale: milrinone can cause dysrhythmias as a side effect, particularly in patients with underlying heart conditions. Monitoring for these arrhythmias is crucial because they can worsen cardiogenic shock. Low blood pressure and an elevated heart rate are expected but should be closely monitored. Question 8. A patient in cardiogenic shock has been intubated and is mechanically ventilated. What is the nurse's priority intervention to assess oxygenation and ventilation? A. Monitoring continuous pulse oximetry. B. Checking for symmetrical chest expansion. C. Drawing arterial blood gases, ABGs. D. Auscultating breath sounds every hour. Answer: C. Drawing arterial blood gases, ABGs. Rationale: arterial blood gases provide the most accurate assessment of the patient's oxygenation, ventilation, and acid-base status in critical conditions like cardiogenic shock. Pulse oximetry and auscultation are helpful, but less definitive. Question 9. The nurse is caring for a patient in cardiogenic shock who is not responding to vasopressors and inotropes. The healthcare team discusses the possibility of extracorporeal membrane oxygenation (ECMO). What is the primary purpose of ECMO in this scenario? A. To remove excess fluid from the body. B. To provide circulatory and respiratory support. C. To increase oxygen saturation. D. To stabilize blood pressure. Answer: B. To provide circulatory and respiratory support. Rationale: ECMO provides temporary mechanical support for both cardiac and respiratory systems when conventional therapies fail. It supports oxygenation and circulation, allowing the heart and lungs to rest and recover. Question 10. A patient is in cardiogenic shock and has developed pulmonary edema. The healthcare provider orders furosemide, Lasix. What is the nurse's priority assessment before administering this medication? A. Serum potassium level. B. Respiratory rate. C. Blood glucose level. D. Capillary refill. Answer: A. Serum potassium level. Rationale: furosemide is a potent diuretic that can cause hypokalemia, especially in patients with cardiogenic shock. Monitoring potassium levels before administration is critical to prevent life-threatening arrhythmias. Respiratory rate and blood glucose are important but secondary considerations in this context. Question 11. A patient with cardiogenic shock is receiving nitroprusside to decrease afterload. What is the primary side effect that the nurse should monitor for during this therapy? A. Cyanide toxicity. B. Reflex bradycardia. C. Increased cardiac output. D. Renal failure. Answer: A. Cyanide toxicity. Rationale: nitroprusside can lead to cyanide toxicity if used for an extended period or at high doses. Monitoring for symptoms such as confusion, headache, and metabolic acidosis is important. Reflex bradycardia is less common with nitroprusside, and while it decreases afterload, renal failure is not a direct side effect. Question 12. A patient presents with cardiogenic shock after an acute MI. The nurse notes that the patient's central venous pressure, CVP, is elevated. What does this finding indicate? A. Left ventricular failure. B. Right ventricular failure. C. Hypovolemia. D. Effective compensation. Answer: B. Right ventricular failure. Rationale: elevated CVP is a sign of right ventricular failure, often seen in cardiogenic shock when the heart cannot effectively pump blood through the pulmonary circulation. This results in fluid backup in the venous system. Left ventricular failure typically leads to pulmonary edema. Question 13. The nurse is preparing to assist with the insertion of a pulmonary artery catheter in a patient with cardiogenic shock. What is the primary purpose of this procedure? A. To monitor systemic vascular resistance. B. To evaluate left ventricular end diastolic pressure. C. To measure blood pressure continuously. D. To assess fluid balance. Answer: B. To evaluate left ventricular end diastolic pressure. Rationale: a pulmonary artery catheter is used to measure pressures within the heart, particularly the left ventricular end diastolic pressure, indirectly through the pulmonary capillary wedge pressure, which helps guide treatment in cardiogenic shock. It also provides information on cardiac output and fluid status. Question 14. A nurse is caring for a patient with cardiogenic shock who has just been transferred from the ICU. What is the most appropriate intervention to prevent complications from immobility in this patient? A. Administering prophylactic anticoagulants. B. Encouraging fluid intake. C. Providing passive range of motion exercises. D. Monitoring for deep vein thrombosis, DVT. Answer: C. Providing passive range of motion exercises. Rationale: passive range of motion exercises can help prevent complications from immobility, such as contractures and pressure injuries, without overly stressing the heart in cardiogenic shock. Prophylactic anticoagulants and DVT monitoring are essential, but physical movement is key to preventing musculoskeletal complications. Question 15. The healthcare provider orders a dobutamine infusion for a patient in cardiogenic shock. Which assessment finding would indicate that the dobutamine is effective? A. Decreased blood pressure. B. Increased urine output. C. Slowed heart rate. D. Elevated central venous pressure. Answer: B. Increased urine output. Rationale: increased urine output indicates improved renal perfusion and cardiac output, which suggests that the dobutamine infusion is effectively increasing myocardial contractility. Decreased blood pressure and elevated CVP would be concerning signs, while a slowed heart rate is not directly related to dobutamine's action. Question 16. A patient in cardiogenic shock has an order for mechanical ventilation. What is the nurse's priority action before initiating ventilation? A. Administering IV sedation. B. Instructing the patient on how to use the ventilator. C. Suctioning the patient's airway. D. Preparing for arterial blood gas (ABG) monitoring. Answer: A. Administering IV sedation. Rationale: IV sedation is essential to ensure patient comfort and minimize distress during mechanical ventilation. Once sedated, the patient can be more easily managed on the ventilator. Suctioning and ABG monitoring are important but occur after intubation and stabilization. Question 17. A patient develops cardiogenic shock after cardiac surgery. The nurse anticipates the healthcare provider will order which of the following diagnostic tests to evaluate myocardial function? A. Chest X-ray. B. 12-lead ECG. C. Echocardiogram. D. Cardiac catheterization. Answer: C. Echocardiogram. Rationale: an echocardiogram provides a direct assessment of myocardial function, including ejection fraction and wall motion abnormalities, which are critical in evaluating the severity of cardiogenic shock. A 12-lead ECG can show ischemia but does not assess contractility. Question 18. A nurse is monitoring a patient in cardiogenic shock who is on norepinephrine. Which of the following findings should prompt the nurse to immediately notify the healthcare provider? A. Urine output of 20 milliliters per hour. B. Mean arterial pressure of 65 millimeters of mercury. C. Heart rate of 95. D. Warm, flushed skin. Answer: A. Urine output of 20 milliliters per hour. Rationale: oliguria, urine output less than 30 milliliters per hour, indicates poor renal perfusion and worsening cardiogenic shock, requiring immediate intervention. A MAP of 65 mm of mercury is acceptable, and a heart rate of 95 is within a reasonable range. Warm, flushed skin is unusual in cardiogenic shock and could indicate a shift toward septic shock, but decreased urine output is more urgent. Question 19. A patient in cardiogenic shock has an arterial line in place. What is the most important nursing consideration when caring for this patient? A. Ensuring the arterial line is zeroed and calibrated. B. Checking for pulses distal to the insertion site. C. Keeping the patient in Trendelenburg position. D. Flushing the line every 4 hours. Answer: B. Checking for pulses distal to the insertion site. Rationale: ensuring adequate circulation to the limb where the arterial line is inserted is critical to prevent ischemia. Zeroing and calibration are important but not as critical as monitoring distal circulation. The Trendelenburg position is contraindicated in cardiogenic shock, and regular flushing is necessary but not a primary concern. Question 20. A patient presents with cardiogenic shock and lactic acidosis. The nurse anticipates which intervention to address the patient's acid-base imbalance. A. Intravenous sodium bicarbonate. B. Administration of a vasopressor. C. Initiation of mechanical ventilation. D. Fluid resuscitation with normal saline. Answer: A. Intravenous sodium bicarbonate. Rationale: in cases of severe lactic acidosis, IV sodium bicarbonate may be used to correct the acid-base imbalance. Vasopressors and mechanical ventilation may be necessary but are not directly related to correcting acidosis. Fluid resuscitation with normal saline is generally avoided in cardiogenic shock to prevent fluid overload. Question 21. A patient is diagnosed with cardiogenic shock secondary to an acute MI. Which lab value would be most concerning to the nurse in this scenario? A. Elevated troponin. B. Low hemoglobin. C. Decreased serum lactate. D. Increased blood urea nitrogen, BUN. Answer: A. Elevated troponin. Rationale: troponin is a specific marker of myocardial injury. Elevated levels indicate that the heart is suffering damage, worsening the cardiogenic shock. Low hemoglobin and increased BUN are important but are not specific indicators of myocardial injury in this scenario. Question 22. A patient with cardiogenic shock requires vasopressor therapy. Which of the following medications should the nurse anticipate administering? A. Epinephrine. B. Nitroglycerin. C. Lisinopril. D. Furosemide. Answer: A. Epinephrine. Rationale: epinephrine is a vasopressor that increases cardiac output by stimulating the heart and constricting blood vessels, making it useful in cardiogenic shock. Nitroglycerin is a vasodilator and would lower blood pressure, while lisinopril and furosemide are not indicated in the acute management of shock. Question 23. The nurse is caring for a patient in cardiogenic shock who has an order for mechanical circulatory support with an Impella device. What is the function of this device in managing cardiogenic shock? A. It augments ventricular contractility. B. It reduces pulmonary vascular resistance. C. It filters blood to remove toxins. D. It decreases heart rate. Answer: A. It augments ventricular contractility. Rationale: the Impella device is a mechanical pump that supports the heart by increasing cardiac output and unloading the left ventricle, thus improving perfusion in patients with cardiogenic shock. It does not reduce pulmonary resistance or filter blood. Question 24. A patient in cardiogenic shock has a Swan-Ganz catheter inserted. Which hemodynamic parameter is the most important for the nurse to monitor? A. Pulmonary artery pressure, PAP. B. Mean arterial pressure, MAP. C. Central venous pressure, CVP. D. Cardiac output. Answer: D. Cardiac output. Rationale: cardiac output is the most critical parameter to monitor in cardiogenic shock to assess how well the heart is pumping blood. PAP and CVP provide useful information, but cardiac output directly reflects the heart's ability to perfuse the organs. Question 25. A patient with cardiogenic shock is being treated with a nitroglycerin infusion. The nurse notes the patient's blood pressure has dropped to 85/50 millimeters of mercury. What is the nurse's priority action? A. Stop the nitroglycerin infusion immediately. B. Decrease the infusion rate and notify the healthcare provider. C. Administer a fluid bolus. D. Elevate the patient's legs. Answer: B. Decrease the infusion rate and notify the healthcare provider. Rationale: the nurse should decrease the nitroglycerin infusion rate, as it is likely contributing to the drop in blood pressure. The healthcare provider should be notified to reassess the treatment plan. Stopping the infusion abruptly may cause rebound hypertension, and a fluid bolus could worsen the patient's condition in cardiogenic shock.